Well, Godrej and Boyce is looking to expand its ultra-low freezers range of freezers, which will help in vaccine storage, and they're also looking at last-mile connectivity when it comes to vaccine administration for COVID-19 vaccines. To talk more on this, we have Mr. Kamal Nandi of Godrej Appliances. Thank you so much, sir, for joining us. Sir, if you can
Thank you.
help us understand that what is first the strategy when it comes to the refrigerators that you have launched, what exactly are the new products that you have launched, and what is your strategy in terms of how many units you are looking to produce, and what are the places that you are looking to sell these units to?
So we have been manufacturing medical refrigerators, which are largely used for storage of vaccines and other medical products since 2015. And we make this ice line refrigerator powered by technology called, very unique technology called short chill technology, which is developed in UK. The uniqueness of this technology is that it maintains a precise temperature of 4 degree, and there is no chance of freezing or the temperature moving beyond beyond 8 degrees. So generally vaccines are stored in the range of 2 to 8, and this can provide a precise of 4. The uniqueness of this technology is that it uses you know a technology which is based on the anomalous behavior of water. And this anomalous behavior of water is nothing but, if you look at lakes, you will find that there are ice on top during winter, whereas the water inside the lake or under the ice covering is at 4 degree. Similar technology is used in this ice line refrigerators or water line refrigerators, which allows the temperature to be maintained inside at 4 degree centigrade precise. So we have been manufacturing this and supplying this to various organizations across the globe. About 36 countries we are exporting. And recently we have been awarded a large tender from Government of India of 95 crores, which is for 12,000 units, out of which 9,000 unit is this ice line refrigerators, and another 3,000 units is for chest freezers, which they use in health centers for dilutants and for ice packs, where the temperature required is minus 25. So we are in the process of executing that order. About more than 55% of the order have been executed, and by March we should complete this. And largely what we understand when we are going and doing the installation and training the people at different health centers, it is largely being used for storing the COVID-19 vaccines, the 2 vaccines that government has implemented so far in the immunization program. So going forward, our focus is that also we have received, apart from the Indian tender, we have also received a tender from some international bodies and some state government of another 55 odd crores. So total about 150 crores of orders in a short span of 4 to 5 months have already been received by us. And the demand is growing. So what we are also now looking at, apart from the storage solutions, we are also looking at delivery solutions now. And so in the delivery solutions, we are largely looking at a mobile clinic, because we know that as the immunization program picks up and we need to move to the hinterland of this country, there will be challenges of infrastructure. And therefore, in order to ensure that the vaccines are stored at a precise temperature of between 2 to 8, that short band, we are experimenting with mobile solutions, mobile clinics. So we have already done a pilot in Maharashtra where we have put our ice line refrigerator 25 liter in a mobile van, and we have taken it to the hinterland of Maharashtra. For 3 days, it was running without power and without any intervention, maintaining a precise temperature of 4 degrees. So the pilot is successful. We have shown it to you, and we will be now developing that. The third phase of a product is the ultra low temperature freezers.
Yeah.
Now we know in India, we are largely focusing on COVID Shield and Covaxin. And in the recent budget, they've announced 2 more vaccines that will get introduced for this immunization program, which is the Zy-Cov-D from Cadila and the Novavax. Those 2 vaccines also requires 2 to 8 degree. But if you look at globally, There are countries and there are places like Europe, like US, like UK, and Australia is also getting into that. Africa, they're going to adopt products like Moderna, or the Pfizer vaccine.
Either way.
So the Pfizer vaccine specifically, the Moderna vaccine requires about -20, where the Pfizer vaccine requires -70. And that's where the ultra low temperature freezers come into play. And this is why we are expanding our range from to the ultra low temperature freezers. Today we have launched those products. They can go up to -86, and they can beyond the application for the Pfizer vaccine, it has got applications in many other medical fields, like your organ bank, your eye bank, your life science, and your biological requirements in medical, plus your it is also required for Ebola vaccination in Africa. So it has got multiple applications. Okay. And
So what is the, I mean, when you're saying you already received tenders worth 150 crores in just a short span of 4 to 5 months, and also it has application for vaccines which are beyond India. So what sort of sales and orders are you looking at in, say the next few months or so, specifically for the newly launched freezers?
see, the ultra low temperature freezers requirement we are expecting to come from the global market. Largely, it will be exported in the short run. Um, and we expect that we should be receiving from UK, from Africa, some orders. We are already, we have launched today, and the marketing activity will start to connect with the respective stakeholders and present to them the product and the benefits out of the product. And I'm sure, I think given our network already present in 36 countries, we should be getting good orders for that.
And how many units are you anticipating approximately? And also in terms of, revenue growth as a contribution to Godrej Appliances as a whole, how much of an increase will that get depending on the number of units that you're anticipating?
So the current order of medical refrigerators that we've got are about 150 crores, which is about 5% of our turnover. Okay, going forward with the ultra low temperature freezers and other requirements that are coming in, we expect about 30-40% growth year on year. And I think what is also important and interesting in this union budget, we have seen that emphasis on healthcare has been given. A lot of funds have been allocated to healthcare. COVID vaccine itself, there's some 35,000 crores have been allocated. So we definitely expect that more investments will go in, expanding and improving the overall cold chain for vaccines and for other medical requirements in the country. Globally, also similar emphasis we are expecting from various organizations like UNICEF, Gavi, and therefore we expect this 30 to 40% growth in this business to continue for a few more years.
All right, so and so in terms of your production and investment plans, if you can tell us how much you will be investing on this vertical, and in terms of the production capacity, what is anticipated, what is the growth that's planned?
So for the medical equipment, Iceland medical refrigerators, we have already increased our capacity from 10,000 to 35,000. Now we are in the process of augmenting the capacities for the ultra low temperature freezers. The current capacity is 10,000. We are working with partners and vendor ecosystem to see that how we can ramp it up to 30,000 per annum in a short span of time.
All right, so talking about appliances as a segment in general, that is one segment that saw a lot of traction as things started to open up. People realized that they need more and more home appliances. Some of them wanted to upgrade, specifically TVs, laptops, etc. In home appliances specifically, how is the traction looking right now? Because there's been a price increase after many years. It's yet to be passed on completely, I understand, but what sort of a traction is there? Has that pent up demand really slowed down, or there is still need based buying? So what are we seeing right now?
So I think January was not a good encouraging month for the industry. After a good run from August till December, where we saw growth in excess of 15% on a cumulative basis, January was flat. And one of the reason, as you have rightly pointed out, is the price increase. Some of it has already got implemented. There are news that prices are going to go up. Also, the overall, consumer sentiments are not reaching the earlier levels of 100 plus. So that is also impacting overall demand. We expect the price increase impact to be on demand for a couple of more months till the summer sets in. I think once summer sets in, then based on the need, demand will once again see spurt in demand.
So, sir, I mean, you've given us your outlook pretty much till the end of this quarter and a little beyond. But for the year 2021, compared to 2020, how do you see the demand and growth going forward? And also, how long do you see these cost pressures being there? Do you anticipate any further pressures as well going forward?
So one is, if you look at FY21 versus FY20, in FY21 we lost out the first quarter practically, so which constitutes 35% of the industry's business. And out of that, I think 10% we could sell in the quarter, 95% is lost. So out of that 25%, which was lost in quarter one, I think we will be able to recover about 10% to 15%. So I anticipate to close the year as an industry. I anticipate the industry will close somewhere between 12 to 15% degrowth over last year. That's an estimation.
That's for FY21, sir.
FY21. And going forward, I think we can expect commodity to soften a bit in quarter two. Because of the sudden spike in demand, I think there are challenges of availability in commodity. There is short supply of commodity, which has fueled the entire price hike in commodity. So we expect by quarter two of next year, in the next financial, that means July onwards, that quarter, we expect that prices will ease off, commodity price will ease off, and we will see price coming down at that point of time.
So, I mean, in general, that rush that we had seen right during the festive season, a little before the festive season, that has slightly died out and is likely to remain a little normal for a while now, in terms of the demand coming in from the people.
Yes, I think had the commodity impact not been there, we could have experienced a similar run even in fourth quarter of this year. But I think now, given this impact of price, that phenomena is expected to come in as the summer sets in. So somewhere April onwards, early April, or maybe later March, we can expect those demand to come back.
All right, sir. Thank you so much, sir, for talking to ET now. Thanks a lot for taking the time out.
Thanks for connecting. Thank you.